Welcome to Focus on Hope. My name is Eve Moffett. I'm your host. In our studio today, we have Liz and Pam.
Hi.
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 Liz is the head of a cancer support group.
Yes.
Tell us about your group.
We meet at Spirit of Joy Lutheran Church in Clarkdale, Arizona. And we started out, first we had a planning committee, and we started out, decided what we wanted to be our mission statement. And so we decided that we would make a mission statement that we would provide support for survivors of cancer, diagnosed cancer patients, their families and caregivers, and we would provide information and then support as needed. And so I felt that it's been very successful so far. We've had a lot of good informative meetings, and each month we meet once a month, and each month we have a different topic. And Pamela and Dobrota was one of our speakers and she talked about nutrition at one of our meetings, and it was very helpful.
Yes. How many in your group?
It varies. We try to reach out to the community by putting out flyers at the cancer centers and in the hospital and in the newspaper. We advertise or have, notices, and flyers in the senior center and rec center and all over. And so it varies. We've had as many as 25 to 30, and then some of our meetings are less. But we try very hard to reach out to the community.
Yes. Cancer used to be a deadly word. People just cancer. But people are living with it.
Yes, and for many, many years, we have one member who has survived cancers 6 times, and she's in remission now over a period of 20 years.
Wow.
And she's very healthy, and we've had one member of our committee who has survived cancer treatment and is living a very active life. So, and unfortunately, we do have people that do go into hospice and don't survive, but it varies. There's so many different types of cancer.
Yes.
And there's so many different types of treatment, and it varies from individual to individual what they need.
How'd you get involved?
Well, through our church, I'm on the council and outreach, and I thought this would be a good form of outreach to the community, and it has been and is. And so that's how I became involved. We actually started as a committee with one other, we have one other cancer survivor, but she's in treatment now, and then a few others that have survived cancer and are remission. And so together as a group, we plan our meetings, and so it isn't just me alone.
Yeah. Pam, you're a dietitian.
I am.
Tell me about your work with the cancer people.
Well, I got involved with Liz's group because they asked me to come and talk about appetite. One of the common things for people with treatment, either radiation or chemotherapy, is that appetite tends to dwindle off after a while for many, many reasons. So one of my goals as a dietitian working with cancer patients, since I do work with them at the Cancer Center at Sedona, is I work with helping them make it through their treatments with good nutrition.
Okay.
So that may mean making sure that they're drinking enough fluids. It may mean that we're changing kind of some of their food choices, making sure that they're actually eating enough food to give them the strength that they need as they go through treatment. So it's been a very interesting journey. A lot of cancer survivors, and there's 14.5 million of them in the U.S.
14.5 million?
Yeah.
Wow.
And they expect that number to go up next
Yes.
year. So it's great. I mean, it doesn't have to be that huge, oh no, I've got it, and then that death sentence that immediately we think of. It actually is becoming much more, what we say, survivable, and may eventually be classified as a chronic disease, which is a whole different way of thinking for us. So, but nutrition plays such a key role for all of our folks who are involved, not only the people who have the cancer, but for those who are taking care of them and supporting them, because they actually end up oftentimes preparing the food
Yes.
and doing the shopping.
Yes. Now, what are the foods that cancer patients avoid?
Well, it's kind of like what we ask everybody to avoid in general. So not a lot of sugary, sweet, dessert type foods, not a lot of junk food, and drinking more water than soda, and avoiding things that have a lot of empty calories in them.
What about alcohol?
Alcohol is kind of an interesting creature. We do know that from a heart standpoint, that 1 glass of wine, red wine, seems to help with the heart benefits. And Cancer Society is saying that, well, for men, 1 or 2 glasses of alcohol a day, or for women, 1 glass of alcohol is acceptable. But the studies are also showing that when you intake alcohol, you increase your risk for cancer. So I kind of leave it up to you, but it's a calculated risk.
Yeah.
And the thing that's confusing with alcohol and with food is that we choose it for different reasons. For example, if I'm watching my heart, then I have to be okay with a little bit of the red wines, because that's where that resveratrol is that helps me. But if I've got cancer or I'm taking medication or other things, I may decide that, well, alcohol is really not that helpful. Or if I'm a very tense person, that alcohol may be important to help me calm down and relax. But if I've got cancer on top of it, I may not want it.
Yeah.
So it gets a little confusing.
Yes. You bought some things. Tell us about them.
Well, I brought them because I do like to emphasize that a good healthy diet for cancer patients is also a good healthy diet for everyone in general. So lots of fruits and vegetables, at least 5 servings a day.
Wow.
And everybody says, wow.
Wow.
But keep in mind that a 1/2 cup of cooked is a serving, and 1 cup of raw is a serving. So I don't know anybody who can eat just 1 cup of salad. Most everybody's salads are at least 2
big,
to 3
overflowing.
servings. So it's not that hard to get your servings of fruits and vegetables. Also, we encourage plant-based foods. So plant-based proteins like beans and nuts like peanut butter are very helpful in the diet. And 1 serving of nuts is actually about this size.
Oh.
So, it's kind of handy to have that. Also, we encourage that you have whole grains in your diet. So we're encouraging things like your whole grain breads, which would be made from either wheat, rye. We have the 5 grain, the 12 grain. All of those are great food choices. Wild rices, brown rices, things like barley and oats. So we all hear about oatmeal, yeah?
Yeah.
Everybody's eating oatmeal. So those are all really important things to have in your diet to stay healthy, because they provide us with what we call phytochemicals. Things that help our bodies actually fight off disease and help to keep our systems functioning normally, and with the vitamins and minerals that we need to just be healthy.
Yes.
So that's why we encourage food.
Yeah. While on chemo, I've noticed a friend of mine. She doesn't no longer have appetite. You run into a lot.
We do. Unfortunately, some of the side effects of the medications can change the way things taste.
Oh,
Okay, it can make things taste either too salty or too metallic. It can even take away some of the taste. Sometimes the medications, whether it's chemo or radiation, makes the tissues in the mouth kind of swell up and get irritated. And sometimes things don't smell quite right. You know, all those delicious smells coming out of the kitchen that we usually do. Well, for them, it smells like, oh.
oh,
So, for those folks, then we encourage that they look at their food a little differently. We look at, instead of a normal half cup of something, you might cut it down to maybe a quarter cup, because then you're able to get down a little bit at a time. And we want those to be really packed full of calories, right, Liz?
Right.
Because you get full quickly. Not only do you lose the appetite, but then you're not really that hungry, and then you get full. So my challenge is to encourage people who are dealing with active issues like this to get enough calories. So I might say, well, when you have that broccoli, go ahead and put a little bit of extra olive oil on it. Give you some calories in there. If you're having your baked potato, maybe have some blended up beans or cauliflower as a sauce. Makes it go down easier. And that way you get some extra calories. Also, we look at things like flavorings. So if you're looking at seasonings, like for your broccoli, things like thyme and rosemary and garlic, all of those seasonings have also been shown to have good cancer-fighting properties as well. So it's really great, because then you can say, oh good, have your food choices, season up so they have more flavor, a little extra, because you want to get past the lack of taste and the lack of appetite, so that you can get those calories in.
Yeah. Liz, you've had cancer yourself.
Yes.
Tell
I
us-
still have cancer.
Okay.
My cancer started it's a very rare cancer. It's called Merkel cell carcinoma, and it's a skin cancer, and it started on my forehead, and I had it removed, and then a surgeon came and removed the margins, and then I had radiation. After that healed, I had radiation treatment, and then about 6 months later it came back, and it came back into the lymph near it came back in the parotid gland, but it was near the lymph system, and it moved from the lymph system to my liver. With radiation, they were able to get rid of all the cancer that's on my head, the tumors and I had a very large tumor in the parotid gland. It was about the size of my ear.
Oh.
And through radiation, that took care of. I have no cancer on my head, and it's been that way for over a year. So I'm very thankful for that. But I do have cancer remaining on my liver, and it's still the Merkel cell carcinoma. It has shrunk some. Recently, I've had TheraSphere treatment, which is I don't think people know about that, but very common. It's just for liver cancer, and what they do is they inject through an angiogram minute, tiny, microscopic radioactive beads, and to a hair follicle there'll be about 5 beads, and they did the first side of my liver, and then about 6 weeks later they did the second side of my liver, and so I'm waiting. I'll have a PET scan to see how effective that was. And so if they can get rid of the liver and the cancer, then I'll be in remission. Or the cancer in the liver, I'll be in complete remission. So that's what I'm hoping, but I'm always prepared for if I need further treatment, I'll have that. So it's amazing the treatments that are available.
Mm-hmm.
And I really didn't know that much about the TheraSphere treatment, but I read in the Cure magazine about radioactive beads, and I asked my oncologist, Dr. Deborah Lindquist, if that's a possible treatment, and she referred me to Banner Good Samaritan, and they did a planning angiogram first to block off any arteries or blood veins that would go to the stomach or other areas that would not be good to have the beads, and so that it would just be in the liver. And then they did after that had a chance to heal, about 6 weeks, then they did the actual treatment, and so I've had 2. So I've had a variety of treatment. I've had chemotherapy, and I've had radiation, and now the TheraSphere. So it's amazing, though. We keep fighting whatever it is, and hopefully reach a point of remission.
Yeah. Some people decide not to have radiation or chemotherapy, do they?
Yes.
Yeah.
Some people, I know of one person that became so ill from, she has pancreatic and liver cancer, became so ill from the treatment, the chemotherapy, and it made her so debilitated that she couldn't work even, and so she decided to go into hospice, and maybe at some point in my journey with cancer, I'm not there yet.
Yeah.
But maybe some point I'll reach that point. But for now, I'm still fighting it.
Yeah. What types of things does your group do?
Well, we try to provide an environment where people can get to know each other so that they can be a support to each other. We have information. We have the nutritionist,
Yes.
Pam, speak to our group 1 month. Last month we had Alan Nickerson, who's a financial planner,
Okay.
talk about finances, which is a very important issue for everybody, actually. And we've had 2 different oncologists come and speak, Dr. Meal and Dr. Lindquist. And so each month, and we had a nurse practitioner come and talk about having optimal health while you're being treated for cancer, things that we can do to feel better and to like exercise, and even if it's a small amount of exercise, and getting enough rest, things that we take for granted.
Yes.
But they're very important when you're trying to keep your strength up.
Yeah.
For your treatments.
Yes. Now, you are registered at the hospital?
Yes, I work at the hospital. I'm a registered dietitian there. We work with inpatient cancer patients there as well as outpatients, so we do a lot of nutrition education, as you can see.
Yeah. Is there anything else you'd like to say?
Well, our group meets once a month on the second Sunday at 10:30, or not, I'm sorry, not 10:30, at 12:30 in the afternoon, and we meet in the fellowship hall. And
Tell us the name of the church again.
it's Spirit of Joy Lutheran Church, and we meet in the fellowship hall, and you can contact the church to get further information. And
Do you have that number?
also my own phone number, which is area code 928-639-0399. I don't have the church number memorized, but it's Spirit of Joy Lutheran Church
In Clarkdale.
Clarkdale.
Uh-huh. Give us that number once more. Your
My
yeah.
phone number, it's area code 928-639-0399.
Okay.
And so I'd be a good contact person to
Very
find out
good.
more.
Yeah. Is there anything else you'd like to say?
I wish everyone good health. Eat lots of fruits and veggies and whole grains.
And stay away from that fast food.
Yeah, be careful of the fast food.
Yeah.
They'll get you.
It'll get you in the long
And the
run.
sweets.
Well, thank you for being on the show.
Thank you.
It's been enjoyable.
Thank you so much.
Thank you.
Thank you so much. It's
Yes.
a pleasure to be here.
Okay. Well, thank you for joining us, and see you next week for Focus on Hope.